Hello, everybody. My name is Dr Reyes. I'm a pediatrician here in Santa Maria Healthcare Center. Thank you for having me in this group today, and I'll be happy to answer any of your questions at this time. I feel like with this whole year and a half going into 2 years of the COVID pandemic, that this is the first time that we can really highlight our pediatrics and the importance of also extending our protection to our children as well. And I know that the COVID vaccine is new, but as Dr. Reyes mentioned, that it's been highly studied in terms of its efficacy and safety, and it's definitely a method that could be of great protection for our kids and for our community. I was eagerly anticipating it, waiting for months. I have 2 boys, they're 10 and 5. And, I've been like refreshing my myturn.ca.gov, waiting for the timeframes to pop up. And they were one of the first ones to receive their vaccines at the Fair Park on Monday. And they even made it into the newspaper. So I'm very proud of them. They didn't cry. They looked at the syringe. My son had maybe a sore arm the next day. The other one said nothing at all. So I think that's like case number 2, but I think they did really well, and I was really proud of them. Well, so to date, we've had, only for pediatrics, of course, we've had 8,300 hospitalizations for children, and hospitalization rates are 3 times as high for non-Hispanic, Black, and non-Hispanic Americans. And approximately a third of those hospitalized kids ages 5 through 11 required ICU admission. And we have also over 6.5 million cases of COVID, and 16.7% of those 16.7% of those cases were children. So that's pretty significant, right? And then in terms of deaths, so in California, we've had about 73,000 deaths total, but about 700 of those were children. And, even though the numbers is not as extensive as the adults, it's still pretty significant. And I would hate to be one of those families to have lost the 700 children, or even having those to be hospitalized because of this illness. Now, those are numbers. And some of the things that we are more concerned about with children are, more chronic illnesses. So you may have heard of an illness called MIS-C, or multisystemic syndrome, which can cause inflammation of different parts of the body, including the heart, the lungs, kidneys, brain, skin, eyes, and the GI system. And so this usually would require hospitalization, and we've seen 48 deaths from this disease alone. And this is one of the things that as a pediatrician, I monitor for kids who have a current COVID infection or have had history of COVID infection, because they can certainly have this inflammatory process occurring weeks even after the infection. And then another reason is, children can also have what we call like long haul symptoms. So symptoms of COVID infection, like being tired, having difficulty concentrating, what we call brain fog, coughing, difficulty time breathing, joint pain, headaches, changes in their smell or taste, lightheadedness. This can persist long after they've recovered from their COVID infection. Sometimes weeks, it can even span to even up to 6 months. As one of the studies in the UK, it showed that about 14.5% of children ages 12 to 16 were still experiencing their symptoms 6 months after the infection. So even though, it may not be serious symptoms, can you imagine having headaches for 6 months? You won't be able to concentrate. You won't really even be able to, maybe even attend school, just depending about the sort of severity of your symptoms. And of course, as we can see, especially with the beginning of the winter season, kids get sick, they get sent home from school. So there's definitely a lot of disruptions in their school. And I think just having the vaccine on board would give them some sort of protection. And also, one of the perks of getting vaccinated is that if you've had an exposure to somebody in class and you're otherwise asymptomatic, you can still remain in school, although there are some precautions like you need to mask, you need to be tested about 5 to 7 days after the exposure, but it shouldn't really be as disruptive as it was as if you were unvaccinated. So those are just some of my medical reasons of why it is important to get your children vaccinated, even though they're healthy. And if you're one of the lucky ones where your kid got COVID and they just had a little sniffle, great. I'm very happy for you that they just had mild symptoms. But as you can see, COVID infection is not harmless. It can certainly cause significant disease, hospitalizations, and even deaths in our children. So I was looking up some of the more common misinformations out there, and I have definitely heard this one in my clinic, unfortunately. So the rumor started, and of course it's inaccurate, and it got circulated in the social media where I think it just got confused with the proteins that's present in the COVID virus, which is the spike protein, and it got confused with another protein called syncytin-1, which is involved in the growth and the attachment of the placenta during pregnancy. But they're actually two very different proteins. And so I think it was just either misinformation or miscommunication or misunderstood. But the spike protein has no involvement in the placental attachment, and therefore has no possible cause for infertility in women. And there's also another study for men where they counted the male sperm count before and after vaccination, and they did not see any difference in the sperm count at all. So for both male and females, there should not be any cause of concern for infertility. In the Pfizer trial, the more common side effects that they have found is similar to the older kids and adults. So fever, muscle aches and pains, chills, headaches, which, and this is what I tell my parents for any vaccine, is that you're introducing something foreign into the body and you're asking it to react, to make all this good antibodies. So in case you get exposed to it later in the future, you already have your soldiers to protect you, right? But with this inflammatory process comes symptoms. So, that's why fevers, muscle aches, not feeling very good, those are all very common side effects from any vaccines because you're having this inflammatory process. Now, some families, especially, for those that, they tell me like, oh, I got the flu from the flu shot, or, I'm afraid I'm going to get COVID from the COVID shot. That's actually not possible because you don't have any of those viruses in the vaccine. You only have those proteins, right, to mimic the virus. So you really can't get the flu from the flu shot, nor can you get the COVID from the COVID shot. And, the fever, the muscle aches and pain caused by the inflammatory process, they usually last anywhere between 3 to 4 days. So I tell my parents, make sure you have your Tylenol and your ibuprofen handy so you're more comfortable while you're having those symptoms. And then they're usually better after 4 days. After I got my booster, I actually had to call in sick the next day because I was also having fevers and chills. But hey, I'll take that over being intubated in ICU or leaving my kids. So I would definitely take those symptoms for the next few days rather than having serious consequences from actually getting the COVID infection. Get them both. So winter's here, and every year we have lots of different viruses that float around during the flu season, and that's just the cycle. So we'll have the flu, we have rhinovirus, we have enterovirus, and now we also have COVID. But thankfully, we have vaccines for both the flu and the COVID. So, definitely would be important for families to get both. And now that we have had some communications from the American Academy of Pediatrics that you can get those vaccines together if you like at the same time. They do recommend that you place each of those vaccines in different arms so that you can monitor for any possible reactions, but you can certainly get them at the same time. There's no time frame to say like you should get one and then the other one. For at this point, we consider it to be safe to get them at any time together if you'd like. And this is the same for the flu vaccine and any vaccines that we give to our pediatric population.